Hello everyone. Today's topic is functions of nutrients and nutritional deficiency disorders. As you may recall, we discussed the three main groups of nutrients in the introductory video: macronutrients, which include carbohydrates, protein, and fat; micronutrients, which comprise vitamins and minerals; and other nutrients, which include water and fiber. Then we went over the many vitamins and minerals that are essential for the functioning of the body. In this video, we will discuss the functions, deficiency disorders, and sources of these macronutrients, micronutrients, and other nutrients. Let's start with macronutrients. First, their functions. Carbohydrates provide the energy that everyone needs. Carbohydrates are divided into three categories. First category, monosaccharides, glucose, fructose, and galactose belong to this category. They deliver energy fairly quickly when needed. Then, disaccharides, which include sucrose or table sugar, lactose, which is found in milk, and maltose. They provide energy slowly. Polysaccharides make up the third category. This category consists of starch, glycogen and cellulose. When you ingest starch, it takes time to be digested, absorbed, and used as energy. The liver stores glycogen, as a reserve of energy. Although cellulose is a carbohydrate, humans cannot digest it. So all of them provide energy in different ways except cellulose. Then, let's see the functions of fat and oils. They are the body's energy reserves. When the body runs out of alternative energy sources, such as glycogen stores, it begins to consume fat. Additionally, they facilitate the absorption and transportation of fat-soluble vitamins. They also maintain cell walls, especially the myelin sheath of neurons, and shield organs from damage by covering them. Let's now look at the functions of protein. Growth and maintenance are crucial functions of proteins. Collagen, keratin, and elastin are fibrous proteins that provide structural support to the body. Enzymes are proteins that aid in many reactions in the body. Many hormones are also proteins that carry out many functions. Proteins help maintain immune function through immunoglobulins, which are proteins. They help in transportation and storage. Hemoglobin transports oxygen and ferritin stores iron in the liver. Protein also provides you with energy when needed. Now let's look at the consequences of not getting enough of these macronutrients. In other words, nutritional deficiency disorders of macronutrients. Kwashiorkor is a sign of extreme protein malnutrition characterized by edema of the body with a protuberant abdomen, usually referred to as pot belly. Marasmus is a sign of severe energy malnutrition characterized by severe wasting. A combination of these two conditions is referred to as protein energy malnutrition. Signs of protein energy malnutrition are stunting, wasting, apathy, irritability, and anemia. We'll then examine the sources of macronutrients. Carbohydrate-rich foods are grains such as rice, wheat, beans, peas and pulses, yams such as potato, manioc, etc. Protein animal sources, meat, poultry, fish, eggs, and dairy products; plant sources, soy, other beans, pulses and legumes. Fat animal sources, meat and dairy products; plant sources, margarine, edible plant oils such as coconut and palm oils. So we covered macronutrients, and now let's look at the functions, deficiency disorders and sources of vitamins. Before discussing the functions of vitamins, it is essential to understand that there are two types of vitamins. They are fat-soluble and water-soluble. Vitamins A, D, E, and K are fat-soluble vitamins and are absorbed into the body along with fats in the diet, hence, dietary fat is required for their absorption. They are stored in the liver and fatty tissues. Unlike water-soluble vitamins, they are not readily excreted from the body. All B vitamins and vitamin C are water-soluble vitamins and hence readily absorbed from the gut. Unlike fat-soluble vitamins, they are not stored in the body and are readily excreted, so we do not have their reserves. Therefore, we need to take them regularly. Now let's look at the functions of vitamins. Functions of vitamin A. The most important function of vitamin A is vision. Vitamin A is essential for good eyesight, especially in low light. Vitamin A supports the immune system. It helps the body's natural defense system work properly. It also helps keep skin and the mucous membranes healthy. Vitamin A supports cell growth, which is critical for the development and maintenance of organs. Next, functions of vitamin B complex. Thiamine, B1, helps the body convert food into energy and is involved in muscle contraction and nerve signal conduction. Riboflavin, B2, helps metabolize carbohydrates, fats, and proteins into glucose for energy. It also acts as an antioxidant. Niacin, B3, helps the body convert carbohydrates, fats, and alcohol into energy. It also helps maintain skin health and supports the nervous and digestive systems. Pantothenic acid, B5, helps the body release energy from food. It's also known as an anti-stress vitamin. Pyridoxine, B6, helps produce and use protein and glycogen and is involved in hemoglobin formation in the blood. Biotin, B7, plays a role in carbohydrate and fat utilization. Folate, B9, plays a role in DNA synthesis, cell division, and red blood cell formation. Cyanocobalamin, B12, plays a role in DNA reproduction, cell formation, and nerve function. Vitamin C2 has many important functions. Those are, tissue growth and repair. Vitamin C helps grow and repair tissues in the body, including skin, ligaments, blood vessels, cartilage, bones, and teeth. Collagen production. It helps the body produce collagen, a protein that's used to make skin, tendons, ligaments, and blood vessels. Wound healing. Vitamin C helps heal wounds and form scar tissue. Iron absorption. It helps the body absorb iron. Antioxidant. It is a natural antioxidant that helps protect the body's DNA, proteins, and lipids from oxidative damage. Supports the immune system. Vitamin C boosts the immune system and helps fight infection. Now coming to the functions of vitamin D, they are, bone health. Vitamin D helps the body absorb calcium, which is the primary component of bones. Vitamin D and calcium work together to prevent osteoporosis. Supports the immune system. It helps the immune system fight off bacteria and viruses. It also regulates the development and function of natural killer T cells, which play a role in cancer and infections. Supports brain health. Vitamin D's neuroprotective properties support brain cell activity. Vitamin D deficiency may increase the risk of developing dementia. What are the functions of vitamin E? It is an antioxidant. It helps keep the immune system strong against viruses and bacteria. It helps form red blood cells and widen blood vessels to keep blood from clotting inside them. It helps the body use vitamin K. Next, the functions of vitamin K. Vitamin K helps the liver produce clotting factors, which stop bleeding by forming blood clots. It helps regulate calcium circulation in the body, preventing osteoporosis. Vitamin K protects the heart by preventing arterial calcification. Those are the functions that various vitamins play in our bodies. Let's now examine the effects of inadequate vitamin intake, or nutritional deficiency disorders. So the deficiency disorders of vitamin A are, xerophthalmia or dry eye and night blindness or impaired vision at night, which is an early sign of vitamin A deficiency. The following two pictures show the identical scene as seen by someone with normal eyesight and someone who has night blindness. Next, we will examine the deficiency disorders of vitamin B. Deficiency of vitamin B1 causes beriberi, with symptoms of weakness and pain in the limbs. Vitamin B2 causes angular cheilitis, inflammation at the corners of the mouth as shown in the picture here, sore throat and glossitis. Deficiency of vitamin B3 results in pellagra, which is a wasting disease characterized by four classic symptoms often referred to as 4Ds, diarrhea, dermatitis, dementia and death. Vitamin B5 deficiency is rare and causes irritability, fatigue, headache and insomnia. Vitamin B6 deficiency causes anemia and may lead to neurological issues like depression, somnolence, confusion, and neuropathy. Deficiency of vitamin B7 can lead to hair loss, brittle nails, and periorificial dermatitis. Vitamin B9 deficiency results in megaloblastic anemia, neural tube defects such as spina bifida in infants, and vitamin B12 deficiency causes pernicious anemia, neuropathy, numbness, memory loss, and fatigue. Vitamin C deficiency causes a disease called scurvy, which is characterized by bleeding gums, loose teeth, anemia, and poor wound healing. Vitamin D deficiency leads to rickets in children, which is characterized by bone deformities and osteomalacia in adults, a condition where bones soften and weaken due to impaired mineralization. This can lead to fractures. Vitamin E deficiency is a rare condition caused by low levels of vitamin E that may result from malabsorption disorders. As it is a potent antioxidant, a deficiency could lead to tissue damage resulting in neuropathy, retinopathy, and muscular weakness. Deficiency of vitamin K causes bleeding tendency due to impaired blood clotting, manifested as easy bruising and hemorrhagic diseases. Given our understanding of how vitamins work and the illnesses that arise from their deficiencies, it's important to understand which foods have enough levels of these nutrients so that consuming them helps prevent those illnesses. So we'll look at the sources of vitamins. Foods that contain vitamin A are dairy products such as milk, butter, and cheese. Fruits and vegetables, with carotenoids. Leafy vegetables and meat, especially liver. Next, foods rich in B vitamins are shown in this chart. Whole grain, meat, nuts, and legumes contain vitamin B1. Eggs, meat, beans, and green vegetables contain vitamin B2. Whole grain, nuts, seeds, dairy products, meat, and fish contain vitamin B3. Meats, potatoes, tomatoes, organ meats, avocado, and whole grains contain vitamin B5. Meats and fish, pulses such as chickpea, dal, and green gram and nuts contain vitamin B6. Meats, eggs, dairy products, nuts, seeds and legumes contain vitamin B7. Organ meats, beans, nuts, and seeds contain vitamin B9 and eggs, red meat, liver, and dairy products contain vitamin B12. In general, foods rich in vitamin B are meats, whole grains, dairy products, nuts, and seeds. However, vitamin B12 can only be found in animal sources. Vitamin C is abundant in citrus fruits like oranges, lemons, mandarins, and grapefruits, and strawberries. Kiwi fruits also contain high amounts of vitamin C. An easy way of getting vitamin D is to expose your body to sunlight, which produces vitamin D in your body. Among the foods, fish, mushrooms and egg yolk contain vitamin D. Vitamin E can be found in nuts, seeds, vegetables and sunflower oil. Some sources of vitamin K are green leaves, cabbage, pumpkin and avocado. That concludes our discussion on vitamins. Let's move on to functions, deficiency disorders, and sources of minerals. Let's start with the functions of iron. The primary function of iron is that it is essential for hemoglobin and myoglobin synthesis and maintenance. Iron is therefore essential for the synthesis and upkeep of blood as well as the healthy operation of muscles. It also boosts the immune system. Functions of calcium and phosphorus. The primary functions of calcium and phosphorus are that they build and maintain bones and teeth, aid muscle contraction, nerve signaling, and blood clotting. Calcium and phosphorus metabolism is regulated by vitamin D, and deficiencies of any may lead to osteoporosis. Functions of magnesium. Magnesium aids in protein synthesis, helps regulate blood pressure, it is required for muscle and nerve function, and supports the immune system as well. The primary functions of sodium are to maintain fluid balance, nerve transmission, and muscle contraction. The functions of zinc include supporting the immune system, it is also required for wound healing and DNA synthesis. Copper aids iron metabolism, supports collagen synthesis and melanin production. Iodine is a key component of thyroid hormones, T3 and T4, that regulate various bodily functions, including metabolism, heart and muscle function, brain development, and bone health. Iodine is crucial for the development and function of the brain and nervous system. Having discussed the functions of minerals, we will now move on to their deficiencies. This table describes the mineral deficiency disorders and their signs and symptoms. Calcium deficiency results in hypocalcemia, which manifests as cramping in the muscles, numbness, and convulsions. Osteoporosis and osteomalacia can cause weak or brittle bones and fractures. While specific deficiency of phosphorus contributes to the development of rickets in children, which causes skeletal deformities, and osteomalacia in adults, which is characterized by weakening and pain in the bones, deficiency of calcium, phosphorus, and vitamin D contributes to all these conditions in varying degrees. Sodium depletion can result in hyponatremia, which leads to headaches, confusion, seizures, or even coma. Hypokalemia is the condition of potassium deficiency characterized by muscle weakness, irregular heartbeat, constipation, and paralysis. Inadequate intake of magnesium results in hypomagnesemia with symptoms of muscle spasms, fatigue, and insulin resistance. Deficiency of iron leads to iron deficiency anemia with fatigue, pallor, shortness of breath, and weakened immunity. Zinc deficiency can cause growth retardation, immune dysfunction, delayed wound healing, hair loss, and loss of appetite. Lack of copper causes anemia with pallor, weakness, and shortness of breath. The signs of an iodine deficiency include goiter in adults and cretinism in children. Since fluoride is essential for healthy bones and teeth, lack of it results in dental caries, weakened bones, and a higher risk of fractures. Given our understanding of the functions of minerals and the diseases caused by their deficiencies, it is important to know which dietary sources have enough amounts of them so that consuming them can help avoid those diseases. Iron is present in red meat, liver, shellfish, lentils, and spinach. Banana, potatoes, sweet potatoes, green leaves and avocado are sources of potassium. Calcium-rich foods include dairy products such as milk, yogurt, and cheese, then leafy green vegetables, canned fish with bones and almonds. Sources of phosphorus are meat, poultry, fish, eggs, dairy products, and whole grains. Magnesium is found in nuts such as almonds and cashews, seeds such as pumpkin and sunflower, legumes, leafy green vegetables like spinach and whole grains. The primary source of sodium is table salt. Sodium can also be found in processed foods, meats, and vegetables. Sources of zinc are shellfish, oysters, meat, poultry, legumes, nuts, and whole grains. Copper-rich foods are shellfish, organ meats, liver, nuts, seeds, and dark chocolates. Table salt is fortified with iodine in many countries, and then it becomes the primary source of iodine. Seafoods, fish, seaweed, eggs, and dairy products also contain iodine. Lastly, we will discuss the functions, deficiency disorders and sources of other nutrients, water and dietary fiber. Water plays a crucial role in maintaining bodily functions, acting as a medium for chemical reactions, transporting nutrients and oxygen, regulating temperature, and aiding in waste removal. Water depletion in the body can occur in cases of diarrhea and vomiting, when using certain medications, and in old age, especially if proper care is not provided. Water depletion can cause thirst, dry mouth, dark-colored urine, oliguria, dizziness, and headache. The functions of dietary fiber are, it helps regulate bowel movements, promote a healthy gut microbiome as fibers act as food for such bacteria. Fiber aids in weight management, it can contribute to lower cholesterol and blood sugar levels. Therefore, low-fiber diet can trigger constipation, bloating, irregular bowel movements and blood sugar fluctuations. Sources of dietary fiber. Fruits and vegetables are a good source of dietary fiber. The vegetable Lasia spinosa is an excellent source of dietary fiber and has quite high levels of it, hence often used as a natural remedy for constipation. Whole grains also provide a fair amount of fiber. So, we covered the discussion on functions, deficiency disorders, and sources of different nutrients that are macronutrients, micronutrients and other nutrients. Here are some additional videos on human nutrition available through this channel. If you find these videos helpful, you can subscribe and click the bell icon to receive notifications when new videos on various topics are posted on this channel. Thank you.